Spinal Decompression BC. I'm Dr. Nima and I'm a chiropractor here at the Westgate Wellness Centre in Maple Ridge. I'm standing next to the DRX 9000 spinal decompression machine for neck and lower back disc herniations. I've been treating neck pain, lower back pain, and sciatica type of conditions for over the past 8 to 10 years, and quite honestly, it's a very difficult thing to treat, and we get great success with chiropractic care, but for some people, when the discs have degenerated too far, they need a little something more in addition to the chiropractic treatments. That's why we have spinal decompression, and I'd like to share with you a little bit of insight on what this machine can do for you. Over periods of time, with improper lifestyle habits that we have, not enough movement, not enough exercise, not enough chiropractic adjustments to be able to keep the joints healthy and moving, these joints in your spine start to deteriorate, and the discs, especially if you sit constantly or you're bending and lifting and twisting in the lower back, these discs will start to deteriorate and compress together. And what does that do? As a result, the joints in the back of the spine start to jam up together, creating irritation in that area. And the worst case scenario is that the discs start to rupture, and that little jelly substance in the middle called the nucleus pulposus will start to bulge, or worst case scenario, herniate, causing, as you can see, a bulging and a pressure and a pinching that will happen on the nerve that starts to send shooting pains down the leg. That's what's known as sciatica, and that's where sciatica comes from. So here we have Sophie on the decompression machine, and she's all harnessed in, and on one end we have the pulley actually gently moving her in that direction, while on the other side we have the harness around her rib cage. That's a nice snug fit that's stabilizing her in place while the machine is actually pulling the disc apart. That pressure of the bulge or herniated disc is being relieved. And what happens is, with decompression, what makes that different is that once you create enough pressure that separates the disc, all the herniation actually gets pulled back into the disc away from the bulge, and that's what provides the relief. So over a period of a series of treatments throughout the program, gradually that disc is moving back in towards its proper place. So she's actually in the middle of the treatment right now. So Sophie, how does it feel? Is it comfortable? Does it hurt?
It doesn't hurt. It's really comfortable. I could almost fall asleep.
So it actually, a lot of the times the patients will have a sensation that there's an actual kind of release of pressure. What will happen is, if you're on the table, you're in that decompression mode, it actually feels relief.
I'm a police officer, so all the weight from the vest and the belt, all together it's about 30 pounds. You carry for about 12-hour shift, 2 days, 2 nights, so it's about more than 40 hours a week that you carry the weight on. Adding the twisting in the car, computers between the seats, so you have to twist to actually write your report, and from all the pressure, the twisting, I started to have a bulging disc, and I couldn't do anything. I couldn't walk for a long time, I couldn't sit for a long time, stand for a long time, to the point that one morning I just couldn't walk anymore. My sciatic nerve was pinched, and I ended up at the emergency. Too much pain. I was at that point that I didn't see the light at the end of the tunnel. I was at 28. I mean, I want to work, I want to be out there and do my job, and I want to be healthy. And here I am at 28, and I can't even walk my dog for more than half hour. And I thought that was over. So I decided to go with the surgery. I went back to my full duties. I started feeling the pain maybe after 5 months, 6 months. You know, it's kind of intrusive, and at the same time, it's... If I had the option to do it again, I would try the machine before the surgery. I was getting adjusted. It helped with my pain, but at the same time, it wasn't enough to actually get rid of the pain and get rid of my symptoms in my legs. I mean, I didn't want to be in pain like that for the rest of my life. Well, obviously I was a little skeptical about, the machine, if that would actually help me. I met other people that was using the machine that was in the same situation as I was, and it worked for them. After a few sessions, they actually felt the relief right away. So I said, I'll try it and see how it goes. I mean, it's a small price to pay for your life, but after half of my treatment, normally it's about 25, so I'd say 12 treatments, I started to feel better. I was able to do a little bit more activity, and at the end of my treatment, I had no pain. I'm slowly getting back to work. I'm now full hours light duty. I know it's gonna get back to my full duties. I'm all excited. I've started golfing, which I thought a few months ago I would never be able to do, and that's a miracle for me. It's a miracle, and it's been great. I can't imagine not doing it now. It changed my whole life. It really did.